So, hello everyone, warm good evening on the finale of the program, the Second International E-Conclave for Oral Cancer. This day we are celebrating a wonderful theme, and we're going to talk about capacity building, how to dethrone that king of all the cancers in the country, the oral cancer, where we have the highest prevalence in the country because of various and multitude of reasons.
I now welcome Dr. Pawan Gupta, MS, MCH in Oncology, a good friend of mine. We have met so many times before also, personally at Muradabad also, and the way he is working for cancer awareness is remarkable. I certainly thank you, Dr. Pawan Gupta, for such a great effort for the public, for the people of India. Dr. Gupta has more than 11,000 cancer surgeries to his name. He is director of Max Institute of Cancer Care. He is founder ICanCare and Rehabilitation. He is member Executive Committee Telemedicine Society of India, Senior Vice Chairman ICanWin Foundation, and he is member National Scientific Committee Addiction Prevention, Rotary Action Group, Addiction Prevention, nominated on 7th February 2021. He is member NTPC, Cancer Prevention and Treatment Advisory Committee, and life member of the Millennial Indian International Chamber of Commerce. He is author of Win Over Tobacco Made Easy, so many books to his name. Be Smart, Do Not Start, Tobacco Cessation, a comprehensive guide, a freedom from slavery, making an institute tobacco free, very important, again a very good book, and course convener and master trainer for India's #1 Gujarat University accredited tobacco control course. There are several awards to his name: ICD International Award in 2007, Vivekanand Sister Margaret Awards 2017, and Delhi NGO Leadership Award 2017. Another award is Asia Africa Leadership in Social Innovation 2019. I here welcome and I hear Dr. Pawan Gupta to come for his presentation on Oral Oncology Connect. I'm sure that will help most of the new people who want to go pursue with the oncology. Thank you. I welcome.
Thank you so much, sir, for this for reading out such a long ballot. I didn't want that, but yes, thank you so much for giving that introduction. And my previous speaker, Dr. Kaustubh Patel, my teacher, my senior, and who has actually molded number of minds across India in oral cancers. So from whatever his presentation he has given, I just take it further. What has been done and what can be done, and of course we have got very luminary speakers coming after me. So just what ICanCare is there, as Dr. Swatangarwal just said about what ICanCare is doing and how it can be built up. The capacity building, that is the most important aspect that we are looking for. So I just start with this word: Rome was not built in a day. That's the common thing that everyone speaks about, and that's a common proverb that everyone talks. Rome was not built in a day. But yes, but they were laying a brick every hour. So this is what is the story of ICanCare. Slowly and steadily we built up, we researched, we gained experience, we penned it down and continued to make an empire to tame the king of all cancers. Yes, to make this empire, it has been an effort. It has been many years that has been built up. But yes, the idea was, it went on, and I kept on pursuing that to build up this entire group, entire people, entire team that will work for tobacco and oral cancers. So the challenges were need for the manpower. Dr. Kaustubh had just said about it. The oncologist is too busy for surgery and clinical work. Yes, lack of interest for prevention or palliation. Specialist lack of time, lack of skill in tobacco intervention. These are some of the very areas that I try to address. The community work for any oncosurgeon is for drawing patient. It's a self-interested work. The community work is limited. They are just for that purpose. Dental surgeon needed a boost and training, better suited for community work, better suited for, they have the entire department. They are the first echelon for the oral cancers. The oral cancers, the king of health cancers. If we can equip, if we can empower the dental surgeons for this purpose, then definitely that is an area that we can always make a history. 70% of the patients who come to hospital have tobacco addiction. This is another observation. Patients get incomplete treatment. We will, if the patient comes to the cardiology department, we will treat for the MI, we will treat for the other aspect, but we will forget the basic thing, that to tell him to quit smoking. And if he is interested to quit smoking, we do not tell him how to quit smoking. So that was another very major area that we needed to address. A well-defined focused preventive community program, that is another area that was lacking. As Dr. Kaustubh has already said it, there is a lacking of the well-focused defined community program. Yes, the hospital employees using tobacco, this was another thing that was very a problem, that we noticed that almost 30 to 40% of the hospital employees are into tobacco. So the very big problem was non-availability of tobacco cessation and oral care centers across India. Yes, I would put it this way: daily 1 lakh, and that was the record that I took out from the Google. 1 lakh Google for how to quit tobacco every day. That is what I found. Every day 1 lakh people Google to find out how to quit tobacco, but they do not have a place. India has the highest oral cancers. Patients are dying early and painfully. 60% of patients who visit cancer hospitals have tobacco addictions. Tobacco is a disease, needs treatment, not quackery. I underscore that please, that it is a disease, it needs a treatment, it needs a proper intervention like any other disease, right? Nicotine has the greatest addiction. Outcome of patients compromised for the present treatment. For whatever the reason that patient might have gone to the hospital, maybe cardiology, pulmonology, oncology, or whatever, it is compromised if we are not addressing this issue of tobacco cessation. The secondary prevention, yes, of course, it is there, so that we avoid the second disease. And we have seen in our hospital, in my practice, a lot of patients who have undergone cardiac, the stenting and other things, but they come back with cancer after maybe 4 years, 5 years, because they did not stop tobacco. Oncology treatment, where oral care is a must. Yeah, wherever we have the oncology treatment, oncology hospital, oral care is a must. So this is just some of the experience that we started. I first set up a tobacco cessation center at Noida and at Muradabad, and both of them, it was a stand-alone PCC center, and it was a failure. This is what my learning was, and it needed something, it needed some value addition, and that is what we understood. So this, the innovation was that how we created a difference. This is what we learned. The solution was required. The TCC initially, all the money, every effort was gone, and then was born the Save the Youth campaign, which we were already doing it, but we started working extra on that. And that is, if you look at the full scope of the Save campaign, S is for sensitization, A is for assistance to how to quit tobacco, T is for volunteer training. That is, we started training the people around us, and I'll tell you about that, and enforcing tobacco-free zones at every place. So sensitization in 3 things: be smart, do not start. We know what tobacco is, easy, and be careful and fearful. And this is what we started, the ambassador, the certificate courses. And I was glad that we, after a long struggle, with the help of Dr. Rakesh, our courses was accredited by Gujarat University, which was a feather on our cap, and we started working across India to empower people, to train people in tobacco cessation. So this was the orientation course, the certified tobacco cessation specialist course, and of course the tobacco marshal courses that we started for the public. And this is another thing that we started looking. If you look at this, the skill gap, there was a lot of the students, the dental students who needed to understand tobacco cessation. There was a huge skill gap, the oral care, the tobacco cessation. So we started the skill up workshops, and that is what for students and professionals to bridge the missing gaps. And we are doing this extensively, and we are approaching the dental hospitals to have this skill up workshops. And we have also started this online program, that is a skill up capsules, that we are also launching very soon. So this is one of the skill up programs that we started online. and this is with one of the college at I think Bangalore. So what the solution is that we need to have centers available across the country, skilled specialists for TCC and early diagnosis and intervention for oral cancers. And this is what is required. Every corner, every place, it should be skilled tobacco cessation specialist, and they should be doubling up for oral care as well and oral screening. And this is what we started, and this we set up at Max as a pilot project. I was glad, and the Max authority gave us the go ahead to set up a center at Max, and we started the 6 things in this program: the oral screening, oral prophylaxis, oral rehabilitation, tobacco cessation, community networking, diagnosis and treatment of the PML, the pre-malignant lesions. We also started working in that. So this created a full aura, a full system that we could take it further. And there was some, actually the most important, as Dr. Kaustubh had also said, that we need funds. Yes, and I have no funding for this matter. So we needed to create funds from our centers itself. And this, putting all these things together, we have been able to run it successfully, and now it is almost 1 year. We are doing it in a very well-defined manner. So assistance tobacco cessation program, this is what we started working. We launched the virtual clinic, and we have now 108 doctors who are trained on our virtual centers, on a virtual platform, who can perform virtual tobacco cessation across India in multiple languages. We started a telephone and a WhatsApp system with the Quit Coach intervention. We had this pharmacy. A lot of medications which are required for tobacco cessation may not be available at the house of the patient. So we started this e-care pharmacy so that we will make it available at the center. And then we kept this book, which was there for the patients, that Win Over Tobacco Made Easy. And of course, we started the quit line number, that is the 011 430 77695, which was a number for anyone across India. Just can call this number, and we have trained people who can help and assist them to quit tobacco. And most importantly, we introduced an ICanCare app, which is the world's first app which is dealing only on tobacco cessation. So what we started lately is to build up to start up the centers. Actually, there was a very major thing that was a skill gap. We had a lot of manpower was required, and then training the people across India, across the dental professions, and that is where we started the Oral Oncology Connect program, a well-designed program for dental specialists. So this is what we started, the OOC CME programs, which was a standalone program. Can you keep that slide, please, Shruti? Yeah. So OOC CME program, that is different idea groups we have started. We have done at Moradabad, Bulandshahr, Aligarh. We have done at almost 8 or 10 ideas we have already done with that. So this was another thing that we started. We started the roundtable meets with oral specialists and oncologists exclusively, inclusive. The oral care, the dental people, and the oncologists we started. And this was a very important roundtable meet when we exchange ideas, we exchange cases, and we started building up on our understanding. So we want to start these case capsules every monthly. I'm sure after this program, we will have more and more people joining it to start this case capsules. Since it will be online, we can have everyone across India. We are looking for workshops, hands-on training, how to do biopsies, what are the various ways, so that the suturing and other things. So this is the thing that we are in the way, and we are planning to start this in the month of June. Tobacco courses, of course, OCTC and CTCS, Gujarat University, a lot of people are now looking for that. And we have this 2 e-conclave every year, that is the month of April, the oral e-conclave, and the tobacco con in July, which is just coming up. And I'm sure this tobacco con, this is the only such conference which is dealing with tobacco cessation. We are not talking about tobacco control, we're talking of tobacco cessation. Oral cancer information on the screening app, the internship programs we have started, the oral care and screening and tobacco cessation centers, which are ICanCare powered. We are looking forward to set up such centers, upgrade the existing centers across India. Camps and workshops with oral specialists to reach out to the public, and IC material sharing. Yes, these are the things we are already into it. I'll just quickly go through it. I'm sure Shruti is running the slide because I'm taking extra time. So OOC RTM East Delhi, that is what we did, the roundtable discussions, roundtable meet, and you can see a mix of oncologists and dental surgeons. Next, please. now you can run the slide, Shruti. So faculty at RTM, mix of onco and dental specialists, exchange of ideas and inclusion. And here you will see the dental specialists are here, the prosthodontists, the pathologists, oral pathologists, the oral cares, and so everyone was there, and we were the oncologists sitting here and talking to them, learning from them. And this is another RTM we started, and the Oral Oncology Connect program. So this is how we have started, and we are working across, and we started this as an Oral Oncology Connect across India. Anyone can register, and we are working on that. And this is another program, the Community Connect program. That is what we started. And this is the tobacco marshals. Here you can see this is the cap, and we are giving this, and we have this cap and batches. We train the people across India. They are the influencers in the society. We train them so that they can work in the society for making it happen. So ICanCare internship program, that is another thing, short rotation program in Department of Oral Oncology, and get practical feel and learning of diagnosis and small procedures in OPD and OT observations. This is what we started, internship program, and 4 interns have already been trained. And these were the 2 interns with the faculty. Yes, we have already trained 4 of them. So this is again with something that we are working on that. So with this program, we have lot of intervention, lot of people are coming in, and you will see that how this it is affecting. Just look at this. Any place they would have done a biopsy or removed it. But what I did, once they joined the ICanCare, Max ICanCare Quit Tobacco program, and look at the way it has disappeared just with quitting tobacco. We did not have to intervene in these patients. Next. And this is another what I call vigilant eye saves life. Here you can see a varicose lesion. It's a very small lesion in a patient who have been taking tobacco. The mouth opening is decreased. We exercise this, and we have given them a mouth opening device. So this is how a rehabilitation, and this was a patient on palliative care who had a tooth abscess, and he was in severe pain, but no one was taking care. His oral cavity was almost so dirty. We cleaned it, did some prophylaxis, drained it out, and this patient was so satisfied and so happy after that. And this is another patient who is a basically you can see how they have, she has improved, and she
here since I've come along thousands and thousands of miles from Fiji to here for the treatment of my daughter, and I'm very fortunate. Thank both of you, Mr. Rohit, Mr. Rohit, and as well as Stanley, Dr. Sita. Thank you, my daughter and my doctor, for treating me. So,
yeah.
तेरा मुझसे ऊपर है कनाता कोई उंगली नहीं दिल पाता कोई.
So these are some of the patient of physiotherapy, chemotherapy. We had to give him the rehabilitation, and he feels so happy. And next slide, Susti. And this is another patient who needed who has come. I had done a surgery 3 years back. Now he has come for rehabilitation.
मैं दीपक जुल्का म्यांमार से आया हूँ. ये मेरा छोटा भाई है. 3 साल पहले इनका ऑपरेशन हुआ था डॉक्टर पवन गुप्ता से. अभी 3 साल बाद हम लोग वापस आए हैं यहाँ दांत लगाने. डॉक्टर अर्चिता मैक्स हॉस्पिटल में अपना भी हार्ट दिखाया, शुगर दिखाया. एक ही जगह में मेरा सब कुछ हो गया. मेरे को बहुत खुशी हुआ, बहुत अच्छा लगा.
These are some of the success stories, and that is what we said. We need to have a complete community where we can actually tame this tobacco or oral cancers. That is, so these are the 4 pillars. What I say, availability. We need to have available centers available. The doctors should be available. They should be skilled. That is skillability, and it should be sustainable model. We need to improve the skills as they go on. Visibility. This center should be visible, available at all places, at all the hospitals, all onco centers, all cardiac centers, all dental centers. These centers should be visibly available, and networking across the society. And this is how I'm sure with the referrals from the networking, we can make a successful program. And I'm sure over a period of time, we can control this menace of oral cancers. I thank you so much. And these are some of the materials, as Dr. Kasturi said, we need to have the materials. And this is where we put in our efforts to develop the materials, jot it down, pen it down, and make it into the books so that it can be taken, it can be helped for skilling up for the lot of people. across India. And this is the ICanCare at a glance. We have got online tobacco cessation 279, sensitized for 689, reached out to 165 children across India, adult sensitized more than 2 lakhs, tobacco patients counseled more than 1,000, cancer rehab products 493, and more than that, cancer patients helped 1,298. That's a number, and we have trained 611 doctors till now. 527 trained across India. Tobacco marshals we have started. This is a old number. I think we have already crossed more than 200. So we are across India. We are working, and we are sure with this whole program that we are running, I'm sure if it is adopted, as Dr. Swatan said, if it is adopted, it can really make a difference, and that is what I believe in. So I leave it to the august audience and all the seniors to judge and take it further to how we can work on it. Thank you so much.
Thank you, Dr. Pawan, for such a live and beautiful presentation and the work which you're doing for humanity. What I gather by this presentation is that an early diagnosis of cancerous or precancerous lesions can save many lives, and to that, dental surgeons can be of great help. And for that matter, you are already promoting so many tobacco cessation centers also. Even I want to add that Dental Council of India has also made it mandatory for all dental colleges to have one tobacco cessation center. But I think if like what you were talking about, that tobacco cessation specialist, if that be there, which you said already you have more than 100 you have made tobacco cessation specialists all around. If those specialists are there in most of the colleges, in most of the towns, that can be of great help. And even I've seen that for Christmas you have made some equipment that is also very helpful. And I think if all colleges and all dental surgeons or all practitioners for oral cancers, they are able to see that, and that will be of great help to most of the practitioners for oral oncology. Thank you, Dr. Pawan, for the presentation. And it is open for audience for any question.
Thank you so much, sir. I think we can have the questions during the panel discussion.
Yes. So
thank you so much, sir, for all the inputs. Thank you, sir.